Zimbabwe has the world's second largest informal economy, with over 60% of the population relying on informal activities for their source of income. According to the Zimbabwe 2014 Labour Force Survey, 94.5% of employment in the country is informalized. Street vending accounts for 15 to 25% of total informal employment in Africa's cities, and 86.6% of street vendors depend entirely on street vending as their source of income. On the morning of the 30th of March 2020, Zimbabwean cities woke up to a 21-day lockdown as a means of preventing the spread of COVID-19. Informal markets were instructed to stop all operations during the lockdown period due to their lack of basic infrastructure, large crowds, unhygienic and often unsafe conditions. This affected a significant portion of the population, particularly vendors and farmers.
Isusu mavenda pakatanga COVID takararama upenyu hwakatirwadza. Transport yanga yakutonetsa kuti uchitakura ninge staff yako uye nayo kunokomba. Saka imwe staff yairasika, imwe yaidona, imwe yakatosvika pakubiwa uchitsvaka transport uchimhanya staff inenge ichitonongwa nevamwe uchichi.
Teso kuvela lo mkhuhlane obekhona i-COVID-19 i-corona le saba lobunzima kakhulu ngoba thina okwethu sikuthola ukuthi sidle sithola ngokusebenza kwethu. Nxa singasaphumanga sasebenza utshengisela abantwana sebulawa indlala.
COVID peyakauya takaita total breakdown. Sekuti ipo papo takanga tine nguva yakaoma. Vana dho vanga vasikaendi kuchikoro, vasikaiti chinyi, asi in terms of food nei takaomerwa nekuti kwakusisina kuti munhu unobuda uchiende kotsvaga something yekuti ukwanise kurarama sevanhu vatinorarama nevending.
If we look at these, how they were affected, they were really affected because most of them, they didn't have income for them to make a living.
The measures that were put in place to curb the spread of the COVID affected vendors negatively. We know it was for a good cause, of course, so that people don't get the bad side of the COVID-19. It was a bad time, but it affected our vendors a lot.
Approximately 90% of Zimbabwe's smallholder farmers sell their produce in informal markets, and their closure caused a ripple effect in the food supply chain. Farmers no longer had access to markets where they could sell their produce. Traders could not access their customers, and customers were unable to purchase affordable food from their familiar vendors.
COVID yakata affecta tichitarisa matengesero ataita plus kunobva zvinhu tichitaura pakutengesa kusafamba kwaita vanhu kwakata affecta pakuti zvinhu zvikauya unongochasa makastoma kune kusina. Totarisa pamovement yezvinhu kubva uko nekurambidzwa kwavaita kufamba murodhi zvaitikonzeresa pakuti hakuna anenge akuuya kuno nezvimwe zvachona zvishoma izvozvo zvava zvakunetsa kufamba. Ende pa2 weeks dzachona dzatakaafecta izvozvo zvinhu mastaff yakafanana nemagaka, maoranges, madomasi nechi yakaora.
Isikhathi seCovid sisihlukuluze kakhulu ngoba sithe sifika kwathiwa kanithwala impahla ngezisendlini, ngazithwala ngasendlini. Khathesi sendlini ukuthi ama-customer ngiwathole kwaba nzima kakhulu ukuthi abantu bezibejayela ukuthi umama Nkomo simthole endaweni engaka. Bathe beqalisa ukungani bayajayela manje babuya bathenga okuyistaff lokade ngilakho endlini kwaphela.
The formal and informal sectors in Zimbabwe reopened as part of government measures to limit the economic impact of COVID-19. Businesses, markets, and services had been operating within restricted guidelines to help curb the spread of the coronavirus. A significant number of markets had damaged roofs, exposing both the seller and their goods to the elements. The marketplace also lacked basic sanitizing stations for customers to wash their hands, which was a key measure in preventing the spread of contagious diseases like COVID-19.
pazvimene musika ule wakanga wakafa batabuda kunze tatisa kufa kwakanga kwakaita usina kana marata tatisa kunze ndo patakanzidzokera mumusika wakatanga covid batadzokera wakadaro wakashama usina kana marata mukati
taitengesera pane dust panga paine dust rekuti panga pasina sirabhu yakaiswa nemarata acho zvese zvanga zvapera kuti nemapozi aya anga apera kurumwa nemujuru amwe anga akutodonha.
It was a very big challenge panyaya dzeutsanana apa tatisina matoilets aitotinetsa nezvemvura zvaitotinetsa and taitobva nezvigubhu zvedu zvemvura zvogeza akatatisa munhu akatenga maapples kana munhu akatenga chino chodongo chikwa ipapo zvaitotinetsa kuti taibva nemvura kumba.
Most markets needed refurbishment in a way that would ensure their continued operation during and beyond COVID-19. The United Nations Development Programme, UNDP, the government of Zimbabwe and other stakeholders worked together under the Partnership for Building Urban Resilience project to build market infrastructure that promotes a safer shopping experience, curbs the spread of infectious diseases, and ensures food systems continue to operate during a crisis. This joint program targeted Harare, Mutare, Masvingo, and Bulawayo.
So when we saw that problem and we started discussing with government, with private sector players, and with our UN agencies, we felt there's an opportunity to actually do something. And do something with markets that sort of traditionally have become difficult to manage, difficult to control, to actually use the crisis as an opportunity to improve that. Right? So looking both from a perspective of how do you organize a market in a COVID-safe manner, right? How do you make sure that the infrastructure is there, make sure that the awareness of people are there, both the vendors and the people that are buying, but also look at things like, is it a good place to have one market, one very, very big market, or you need to look at satellite markets to sort of manage the flow much better?
UNDP comes in at the request of government. The Ministry of Agriculture developed the initial concept of resilient supply chains, and they requested us to look into how we could possibly mobilize other support and other partners to support the development of resilient food supply chains in the face of COVID.
The project aimed to mitigate against disruptions to national food supply chain systems in Zimbabwe in the face of disease-related shocks. This would be achieved through decongesting, adapting, and transforming the food supply chain so as to contain and prevent COVID-19 from spreading while guaranteeing adequate food supply and continued livelihood opportunities.
So basically we reprogrammed some of the urban resilience medium-term interventions towards addressing the safe markets. And it was done basically through three main components. The hard infrastructure, which is specifically refurbishing market stalls so that they're more compliant with COVID rules, that they're safe for vendors. And then the second component was in terms of livelihood support, because a lot of vendors were left without livelihood options. And the livelihood support activities focused mainly on cash for work, so that through cash support they would conduct disinfection of public areas such as markets, bus termini around markets, and these kind of spaces, as well as the community health clubs that work in the markets. They would be capacitated in terms of producing the items that that are in demand during COVID times, such as hand soaps, sanitizers, cleaning detergents, and so forth. And the third component is institutional support, which is basically working with urban local authorities and market authorities to develop SOPs for safe market operations, for looking into bylaws to see how they can sort of cater and provide for such situations, and so forth.
Within the informal economy, vendors are of special interest to the UNDP's Accelerator Lab, as vending is often the only source of livelihood for the most vulnerable populations in urban society.
As the Accelerator Lab, we are part of the fastest learning network in UNDP. And one of the things we were tasked with was informing the intelligence that would be enacted within the Resilient Food Supply Chain project. Now, what we actually have done so far is given intelligence towards understanding how we can improve value chains for market vendors. And we have done so by helping understand or helping people within the ecosystem to understand how things actually work within markets.
The establishment of safe markets infrastructure that complies to COVID-19 and other infectious diseases and is gender responsive is key at markets to prevent and mitigate COVID-19 outbreaks and beyond. This requires participation of councils as they are the custodians of the cities and towns. The shed at Mbare Musika, the biggest farmers market in Zimbabwe, was refurbished through the support from UNDP and Oxfam, which saw the transformation of the vending site. The rehabilitation of Glenview 1 and Budiriro 1 market stalls was completed, and the vendors are now selling their products on refurbished markets.
UNDP ndobva vakazouya vakasangana neoxfam ndopakatoda kugadzira musika wenyu kusvika musika wedu wapera zvaurizvi. Mashandiro edu akachinja nokuti muno maasimati vazhinji vanoda kutenga zvinhu zvinenge zviri pane simati uko kwataitengesera kuti kenge tichionga muvhu chaimo saka kwenge kusina hutano hwakanaka. Saka muno muri simati vazhinji vanototiza kwachiuya muno kana vamwe wabuda zvavo muno kuno vanotoya muno vachizotenga muno vatoti musaka muri simati.
Taive nechallenge yekuti mvura yainetsa kuwana munomu tisingatarise nezvecovid chetayo tinotaura general kuti kubvira nekubvira kumashuru mvura tatisina but ezvinezvi ane mvura iri pamatenga mukaona pane matengi takaisirwa inenge inoiswa futi sanitizer takapiwa munomu.
In an effort to address the disruption in the functioning of the food supply chains in Mutare town, CARE, with the support of UNDP, rehabilitated 7 markets, set up hand-washing stations at 13 markets, and constructed 1 main market at Zimta Main Market, with the aim of improving the food supply chain system in Mutare town in the face of COVID-19 related shocks.
The construction of this market yakatibatsira as a council kuti ma-vendors akawana pekusenzera, because it was a headache to us as a council because we had not budgeted for the construction of this market. But kuya kwakaita COVID pachidiwa kuti pange paine space yakakura ino accommodate vanhu vakadini wakawanda takatasa physical and social distancing muma markets, and kuma vendors acho pachezvawo akawana pekushandira pakanaka.
Saka petari pana pekuzvinezvi manje takagirwa matoilets akanaka zvekuti plus mvura muri kuzviona yakangozara pese pese. Tiri about 1 2 3 taps dzine mvura running water zvoti pakachena, and vakastomers anofara achingopinda pagedhi obva atogeza maoko ake nekunyatsa kuti akashambidzika ere akachena ere ochipinda muno mototsvaga zvaanenge achida.
Zvakatibatsira zvakare kuti makuisa kwawo shedhi itsva hatisisina kutya nekuti mvura peiri kunaya haichadonheri zvinhu kuti old shedhi yaitidonesere zvinhu zvetinenge takaronga. New shedhi ine yakazogadzirwa necare hazvichadonheri ba.
One of the biggest challenges is to ensure that all movements of food from farmers to distribution hubs, food markets, and ultimately consumers is done while abiding by health and safety regulations. Market actors and stakeholders needed capacity for effective use of online market platforms and other market tools during social distancing and value chain disruptions. The Accelerator Lab is developing an approach to establish a safe and resilient agricultural supply chain, facilitating information flow that ensures the continuation of movement and supply of goods from smallholder producers in the rural peri-urban areas to high-density urban areas.
Sizimele, which is the consortia under Danchage Aid, then came in to have a database. They created a database which was based on the farmers, the vendors, as well as the buyers and transporters, to see how they can connect them together. And how best they could connect them was through creating an app.
So the idea is to aggregate, is to bring together these players and facilitate the smooth flow of business. And one also aspect that is coming in this intervention is trying to create an online hub or an application that we have called the Sizimele application that links also producers and the sellers, in this case traders, to be able to go to the platform and look at who is trading what, and then be able to place orders and get their goods coming to wherever they are trading. And here in Bulawayo, we are covering 9 food markets, and we've been training these traders also on business development under the Sizimele aggregation project.
The system will ride on more than 20 informal markets and hundreds of vending sites across the country, utilizing stakeholder data and databases to link digital innovation with the supply chain platform. The UNDP-funded project has left an indelible footprint in the operational wards in terms of both infrastructural development and software activities that have seen positive gender perspectives from the community. The growth of the informal traders is now necessitating a change in the approach of urban planning in emerging cities in Africa. And now Zimbabwe is at a place where innovative interventions need to be explored and adopted to manage this ever-changing landscape.